Hi, this is Dr. Eliana Aaron from EmaCare. I hope everyone is doing well, staying healthy. I'm going to answer questions today. Today is March 31st. Today is the 40th day of coronavirus in Israel. We have some questions related. Well, we have a lot of questions. I'm going to have to start doing more than one video a day, but I'll try to get to the ones that we got recently. I think these we got today. Does putting food in the refrigerator lengthen the amount of time it can have the virus on it because of a lower temperature, like a carton of eggs? So a carton of eggs, I mean, they are not stored in the refrigerator and they don't have to be in the short term. So a carton of eggs, for example, can be left out for 24 hours and then put into the refrigerator. It is not likely you're going to have any problem with the eggs themselves. I don't have a problem with it. Once they're packed, the only thing that's really handled is the box. I mean, people touch the eggs a little bit, but that is true. But again, we don't eat raw eggs. We cook them, hopefully. We bake them, and again, the inside of the egg is okay. If you do decide you want to wash your eggs, and there are people that believe when there are certain bird flus, like avian flu was transmitted from bird feces. So if you're in a country that does not process eggs with washing, like in America, they wash eggs before they pack them. In Israel, they don't. So if you decide that you want to wash your eggshells, that's fine. And when there's an avian flu outbreak, I'd actually recommend it, but they must be dried, because washing eggs actually increases the chances of bacteria getting into the actual egg through the eggshell. So they do have to be dried before they are stored or used. And that's very important. So if you wash them, you have to dry them well before you either use them or store them. How do we store them? Okay, that also answers the second question, which is how to store them for Pesach, and can we be concerned about virus on the eggshells? And I just answered that. I think also, let's remember that, and I don't think I mentioned this before, but viruses can live for a very long time in the freezer. Remember, viruses by nature are dormant. They are not alive unless they have found a host, a living host. So what happens to viruses that are frozen is that they end up just going dormant, and they can stay in a dormant stage for a very prolonged period of time. That's even been measured in certain viruses for years. So it is important when you get things that are frozen to wipe the container before you put it in the freezer. The refrigerator, same thing, everything can be wiped down. Cardboard, again, 24 hours. So if you can't, if you are not comfortable leaving your eggs out, put them in a bag in the fridge. And then after 24 hours, throw the bag out, the eggs are fine. Okay. General information, do you know what website to follow for the epidemiological curve in New York? There are some websites that are more accurate than others. The Johns Hopkins website is very good. It actually breaks down the number by county. So you could actually look at New York numbers on that site, and it does show you daily what the numbers are. If you want to track it, then you have to sort of, keep track of it day by day to see what's going on, but that will give you a nice idea. And I think that's considered a very reliable model. Okay, now we have a nice, interesting question that's going to involve a lot of sciencey answers. Please explain the difference between the N95 and the KN95 mask. So this is a very controversial issue. So the N95 mask is a medical respirator mask that is made for medical personnel. It has always been a medical mask. Okay, there are other masks that are used for construction workers and people who work in high dust environments to protect them from dust particles. But the N95 mask has always been a medical mask. And it is meant for people who are working in close contact with people who are ill with respiratory droplet or aerosol diseases. Okay, so highly contagious diseases like tuberculosis and measles and chickenpox and COVID-19. So the problem is, of course, that we know there's a worldwide shortage of N95s. Part of the problem is that stockpiles were low. Part of the problem is that China stopped exporting the masks when they had their own outbreak and only started now reproducing more masks. So, see, I touched my face, so now I sanitize my hands. So basically, the KN95 masks are controversial, and I'm going to explain why. Basically, the N95 masks are approved by the National Institute for Occupational Safety and Health, which is part of the CDC. It is FDA approved for medical workers in these high-risk environments, okay? So it has a specific kind of filter. It's made with a filter. Sometimes it has a knob as a filter, and sometimes the whole mask works as a filter. But the respirator blocks at least 95% of very small particles, okay? And if it's properly fitted, and that's a big if, but if it's properly fitted, it has the ability to protect somebody from outside exposures, okay? But if it's not fitted properly, okay, then it's not going to work, and virus can get trapped in, and then you're just breathing virus, okay? So if it's not fitted professionally, it is useless. It could be even worse than having a regular mask. So N95s are for medical workers only, and they are not needed unless someone is in very close contact with an ill person. Okay, so very important to know. It can't be used if you have facial hair. It can't be used for children because it's not meant to be fitted over their faces. But it is for healthcare workers. Okay, so they're actually telling people who are healthcare workers to shave their beards and trim their mustaches so that there's a good fit. It does not completely eliminate the risk. No mask does. And that's very important to know. I said 95, not 100%. Okay? Now, the KN95s are produced in China. Okay? They are not FDA approved. And China claims that they are equivalent to the N95. They were tested, and what they basically found is that there is some inward leakage, about a little less than 8% leakage of outside particles. So that means that there's more leakage in those masks. There are also, Reddit has an article about fake fake KN95s that are being sold on the market now. So you have to be really careful. Basically, last week, because there's a shortage of protective gear, the FDA issued an emergency authorization for non-N95 respirators that have been certified by Australia, Brazil, Japan, Korea, Mexico, and the EU. But the KN95 was not included in that. So keep that in mind as well, that the masks from other countries have been, probably because there is a possibility for having fake masks that don't have the proper filtration rate that they claim coming out of China. And there's a lot of concern about that. It could be political. I don't know, but be wary. I'm going to tell you now about surgical masks, okay? So surgical masks are the ones that you put behind your ear, usually. Sometimes you tie them. They're very simple. They help block large particle masks, large particle droplets that are coming out of your mouth, and it does protect other people. Now, if everybody used them, then there would be a lot less respiratory particles floating in the air. So obviously, you know, that's a good thing. We like that. Surgical masks also do have the limited ability to also protect you from inhaling other people's respiratory droplets, but because it's not really sealed, it's not, you know, it's not foolproof. But again, the N95 is not foolproof either, so keep that in mind. So the surgical mask is the one that is recommended if you want to protect other people. But in general, if you have good hygiene and good social distancing, that is going to be the best protection that you have. And you may not need a mask. Now, I know there's new regulations expected out regarding mask use, and there are some countries requiring everybody to have a mask when they leave their house. And I think that's being considered here. And that's for the consideration of other people, because again, we talked about the silent sick, okay? The people who have this disease and feel fine, they have no symptoms, and we just don't know. So in New York now, they're basically saying, expect and anticipate and act as if everybody has it. So if you think about that, then everybody should be wearing a mask. So it's not just about protecting yourself, it's about protecting others. If you protect others by wearing a mask, then hopefully others will protect you by wearing one as well, and there'll be a lot less virus floating in the air and being transmitted in all kinds of lovely ways. Another question, once a person is infected, and they start having symptoms, how does that normally progress? How quickly do things progress? This is a very, very difficult question to answer because, you know, this virus is not a typical course. You know, chickenpox is much more predictable. Most people get it, they get a fever, they get a rash, it's itchy, it starts to go away, everything scabs over, and then they're fine 2 weeks later. This virus is very virulent. It spreads very quickly. There's a delayed time between when you catch it and when you get sick, and that could be up to 14 days in most cases. So what does that mean? That means you can start developing symptoms on day 2. You can start developing symptoms on day 14. The symptom progression is not consistent. There are people who get a slight cough and then they're fine. There are people who get a high fever and then a few hours later the fever's gone, but they have the virus. There are people who get very ill and recover. Recover meaning that they recover enough that they're medically stable, and then within hours they're on a respirator. So it does go like this for many people. And of course, we know that, you know, the respirators, everyone's talking about them and the numbers, that's where this disease goes, is it attacks your respiratory system, but it also causes multiple organ failure. Okay, so towards the beginning, we knew it caused kidney failure, but we now know it actually causes multiple organ failure. And these patients are very, very complicated, and it's very serious. So thank goodness that's a small percentage relative to the larger number of people who have coronavirus. But we have to keep in mind that you cannot predict the symptoms, that you could feel a little bit sick one day and then fine, and then get a fever a few days later. It's no two stories seem to be the same. And that's really saying a lot. And that's one of the challenges that we have, is that there are so many symptoms being reported, anything from gastrointestinal to respiratory to only fever to, of course, nothing. And so I can't answer that. I'm not sure anyone could really answer that. What we do know is that when people start destabilizing, it happens very quickly. So you could be sick for a week and you think you're getting better and you feel like, you know, you're recovering, and then all of a sudden you could start having respiratory difficulty and need to go to the hospital. So unfortunately, that's a tough one. Can't really answer. I am going to send out the epidemiology information today so everyone can see how we're holding. I hope everyone stays well, stays safe, stays healthy, and stays home. Take care. Bye.